Welcome to Airway Breathing Conversation, a podcast presented by the anesthesiology residents at the University of Saskatchewan, created to provide individuals of all levels of medical knowledge with anesthesiology-related healthcare information. Join us this week where Doctors Churao Yang, Krissie Urmson, Monica San Vicente, and Ashley Meister, all fellowship-trained anesthesiologists working with the University of Saskatchewan and Saskatoon, discuss their individual fellowship experiences. Now, whether you are an anesthesiologist, resident, medical student, or member of the general public, come take a break with our host, Anesthesia PGY3, Dr. Sebastian Turcott, and a multitude of brilliant and insightful guests as we demystify the incredible specialty that is anesthesiology, one episode at a time.
Okay, and hello everybody, hello listeners. Welcome to another episode of Airway Breathing Conversation. My name is Sebastian Turcott. Behind the mic and with all the production is Dr. Alan Meldrum. Shout out to Alan who puts this all together as always. And today we have a very exciting episode. We're going to be talking about fellowship training opportunities within anesthesia. We have an amazing lineup of speakers to chat with tonight. And as people on the video feed will notice, I'm wearing a hat today because we're recording at the end of the day and all of our amazing speakers are also coming in at the end of their workday, and we're super appreciative to have them today. First off, we have Dr. Churao Yang, who is one of our staff anesthesiologists here at the UofS. Dr. Yang, do you mind just introducing yourself, telling us a little bit about your anesthesia practice profile and where you did your anesthesia training?
Sure. Yes. I'm Churao. I guess that, a little step further back is I'm, grew up right in Saskatoon, did literally all my training here from elementary, high school, undergrad, medical school, and then, eventually residency right at UofS. So a little bit homegrown.
Nice.
But my practice profile, I'm a bit of a generalist, I would say, but obviously my fellowship training has some influence on what I do in my practice. So my background is a subspecialty training in regional anesthesia. Mm-hmm. Regional, I guess, we might get into the conversation later on about it, but it's one of those that you could tailor it into more or less something that you do day in, day out, or it could just become something in your back pocket that you have an extra skill set in. And that's the latter is kind of more of what my practice is like these days. I work at all three major hospitals in Saskatoon, and regional, comes up depending on which site we work at. The elective orthopedic hospital, obviously we have a blocks area there, so regional comes in handy pretty commonly there. But also in the other sites, it could be something that you never expect on call. Somebody comes in and regional would benefit, and there you go. So.
Yeah. Sounds like just being able to have extra tools in your toolkit almost. And we've talked about that on previous episodes too, about how with any given patient, your anesthetic can always look a little bit different, right?
Yeah, exactly.
So that sounds great. Where did you complete your fellowship training again?
I did my training at Western University.
Okay, cool.
In London, Ontario.
Nice.
The less well-known London, I guess.
Yeah. Fair enough.
Even the locals were joking about that.
Yeah. Nice. I've never been there, but I did look it up during my CARMS applications. Looked like a great city to live in.
Yeah,
so
good.
Oh, very cool. And what sort of motivated you to pursue your fellowship training once you were done residency?
I'd say partly it was interest. I definitely was interested in regional anesthesia. But the other half of the equation was at the time that I was kind of in the middle of my residency training, jobs were not as abundant as right now for anesthesiologists. Mm-hmm. And we kept hearing that to, really be able to market yourself and make sure you're good from a job perspective, job prospect perspective, that fellowships were recommended and encouraged by our program. And plus, we were always, looking for people to go elsewhere and bring training back to the program. So, for those reasons, I decided to pursue this fellowship.
Okay,
Yeah.
cool. Yeah. And you mentioned you're from Saskatoon. You've lived here most of your life. What was the transition like to go away for a year? And how did you find that?
It was good. In retrospect, it was great. I really enjoyed my year. It kind of tied in with my personal life a little bit. So at the start of, as I was preparing to embark on this year, it actually I wasn't super happy because one of the major reasons was my wife, which then was my girlfriend. We had met in fifth year residency, which would have been February. And then my fellowship was due to start in January. So as we were making preparations for me to leave, that would have been, roughly about half a year as we were just together. So it was pretty tough to, as you started to get going, and then you have to move halfway across the country and do long distance. But certainly at the start it was tough. But in hindsight, though, actually my wife was able to come out with me, and she's an occupational therapist, and London has a really strong hand and upper limb center.
Oh, cool. Yeah.
So she actually did a little bit of a mini fellowship herself in hand therapy, which is what she specializes in.
Yeah.
So she was there for about 4 months of that year. So it was good. It broke it up, and that was kind of the first time we moved in together. And so London, in many ways, it was a big milestone in my professional and academic career, but also personally, it was you got to experience a totally different part of Canada. And first time me and my wife lived together, and we didn't kill each other. So that was
always good, right? A little bit of a stress
test. Yeah, exactly.
Cool. Sounds like it opened up, some opportunities there too. Even though maybe it felt a little bit daunting. Is that sort of what I'm gathering?
Yeah, exactly.
Okay.
No, as you leave, it's always not the, because you're leaving your comfort zone, right? And also for me, I guess I should mention I did my fellowship kind of a staggered start. So it was a January start, which meant that as I finished residency, I had a 6-month period where I was already practicing as a attending here in Saskatoon. So that was one more reason as the date got closer to me leaving for London. I was thinking, I'm already, starting to feel a little bit comfortable as staff here. Now I'm going to go back into training mode again. So
certainly, like once you are in training mode, it might be tough to jump back into it, I guess.
Yes. That's why I would say if having a bit of a staggered start is certainly not a bad thing. There's some great positives there. You get to, assuming you start your practice in the area, in the city that you trained in, you get to continue on right into a staff role in a center that you're very comfortable in, because as you go into practice, it's a huge learning curve as well, not from necessarily a knowledge content, but for just logistics of how to run the room as a staff. So it's nice to get your bearings there and then move away, because as you know, in fellowship you do spend quite a bit of time essentially as a staff. You don't have a staff license, of course, but you independently practice and run rooms.
Yeah, cool. What does your day-to-day sort of look like during your fellowship training versus what it looked like during your residency? Was it different or was it very similar?
I guess different in that, when you're in fellowship, your fellowship training year, days that you spend doing your subspecialty, is heavily focused in that area. Whereas in residency, you spend time in multiple areas, multiple rotations. So, I guess, it was in a way a little bit easier to prepare for your day because you're going there to do what you've been doing every single day of that year. You know, when you go, you know what to expect. Yeah.
Nice. So a little bit more familiarity, I guess, from a day-to-day kind of thing.
Yeah.
Yeah. Okay. Awesome.
Exactly.
And I guess you've already touched on this a little bit, but what were some of the benefits or takeaways that you took away from your extra year of training at Western that you would sort of pass along to somebody else who might be considering a fellowship?
Clinically, certainly, of course, whatever fellowship area you choose, you're there to, pick up an extra set of skills, and it would have been. It usually equates to a set of skills that you might have had some exposure in residency, but it hasn't been covered in that sort of depth and during residency. So. Certainly, I always feel like if you have that set of skills, it will definitely come in handy in your practice. Whether it's day to day or also being able to, market yourself when you're looking for jobs. Most centers in Canada do have a desire to hire people with subspecialty training because it brings, more knowledge to the local group. So yeah, certainly from clinical content, I think it's a great opportunity to enhance your skills and learn some really new cutting edge things. But from not purely talking about academics, I think it's I kind of talked about it even before, is that I think from a local department perspective, having people go elsewhere, it's almost like you're a busy bee going away and collecting pollen from different different flowers. It brings more to the pot when you come back. Undoubtedly, your skills will help the department, but also your perspectives that you pick up. And in that year, what we see of the other places, some things might not be as good and some things might be better. So just different perspectives to bring back.
Yeah, that's really great. And then I guess passing that along to everybody else in the department too. And different skills or different equipment. I know sometimes we've procured different equipment just based on what people have seen elsewhere. So yeah,
exactly.
Pretty cool. Okay.
Yeah.
And how did you go about organizing your fellowship training? Because I know some fellowships might be through the Royal College, if that's intensive care or chronic pain. Others, I think, are more of an interview-based approach. Do you have any insight into that?
Yeah. So my process was that I just applied to almost all of the English-speaking regional programs in Canada, which there aren't that many. Being a smaller country, even some of the bigger centers, not necessarily all of them have regional. So I applied, and I kind of the whole reason why I was staggered was also because I had originally intended on starting my fellowship right after residency, but I was quite interested in going overseas for my fellowship training.
Okay.
Again, when I was planning this, and some of the fellowships, when it's competitive, you have to plan about 18 months ahead of time.
Okay.
So at that point, I had not met my girlfriend, or now wife. If I had known, I don't know if I would have gone through with moving, halfway across the world, just in a new relationship. But anyway, so I was quite interested in pursuing opportunities in Australia. It didn't work out. And then when it came time to kind of redirect my focus onto the Canadian programs, I had missed the deadlines for the July starts. So I didn't really want to wait a full calendar year. So that's why I went in the January pool. And there were not as many programs offering January starts.
Okay.
A lot of programs, all of them have July starts, but not all of them have January start dates. London, I also had a really good friend of mine who was a resident in anesthesiology there at the time, and he kind of got some opinions of some of the fellows there at that time, and just from his personal experience, we talked a little bit, and I decided to include London in my application, and they reached out with interest of bringing me on, and then from there it was very informal. I don't know exactly how the accredited fellowships work. I know it's a match process through CARMS, but the non-accredited programs, it very much does become almost like a word of mouth. Like, if you knew somebody, or in this case, my friend who was a resident reached out to the fellowship director, and then I did submit, the paperwork that they needed, and then got an interview and was notified. I can't even remember how they notified me, actually.
Yeah. Either way, I guess you got there. So that's great. Yeah. Okay. Well, that's really good insight that some programs can offer a staggered start and others don't. So I guess based on what you're saying, like your recommendation, if somebody's interested in looking at a fellowship, starting to plan sort of 18 months in advance, even in their third, early fourth year, kind of to start thinking about things, if that's something that they're considering?
Yeah, I would say, always start thinking the earlier, the better. You don't know what personal circumstances might come up that might, might influence your decision. But as soon as you think you might have a potential interest in it, in a particular area, then I'd say maybe in that third to early fourth year period during residency, if you have the opportunity and means at all, try to go to one of these one of these locations for a residency elective.
Yeah.
I did an elective in pediatrics in fourth year, and then a regional elective in third year. I was considering both of these at that time. So it kind of helped me narrow down my decision making.
Okay. Yeah.
I think it's just same as when a medical student is applying to a residency program. Until you spend some time seeing the day in, day out routine and schedule, you don't get necessarily a full appreciation of what it's like.
Yeah.
Obviously, you can't do I don't even know about medical students these days. From what it sounds like, they get very little out-of-province exposure. But when I was going through medical training, we spent a lot of time out of province. So, you got to see multiple areas. Obviously, that's not practical during residency to take that much time off. But I think if you can even earlier on identify if there is one potential city or school that you would really like to pursue that program, then try and get an elective there. That not only will give you the best insight into what the program will be like if you do choose them to complete your fellowship, but also set you in put you in a really great spot for when it comes to applications.
Okay.
I know some programs are very, very competitive. So.
Yeah. Okay. Well, that's really good to know. And that's, similar to that thought, I've sometimes had medical students ask me who are undecided about which residency program to pick. Some advice on that, and similar to what you were saying, just immersing yourself in that a little bit, whether it's through electives or whatnot, probably gives you a better idea of the day in and day out approach to things versus the surface level things that you think about what that sort of looks like. Hey,
exactly.
Yeah. Okay. Yeah.
We're as a resident, you have some advantage in that, some of the staff that you work with, or at least when I was going through the staff that I worked with, did go through fellowships of their own and did do regional fellowships. So I was able to get some insight from them as to what that
Okay, cool.
like.
Yeah, nice. And was there anybody in the department here that sort of helped you organize fellowships or helped sort of mentor or guide you a little bit in terms of deciding?
Yeah, Dr. Jacqueline Larson and Dr. Ashley Meister, the two predecessors in regional anesthesia before me. They were great mentors and great teachers. First of all, that's how I really got excited in regional anesthesia, and then when it came time to look at electives, both of them did their training in Ottawa, so that's where I went for my elective, and then later on for fellowship, and continue to stay in touch with them. And
oh, awesome!
Yeah,
and we're gonna have Dr. Meister on a little bit later too, which is great. So we'll get her insight a little bit too. Cool. And then you run our regional day, which is always a big hit in our residency program. We sort of get a full day of regional teaching, and then we get to practice a little bit on some meat models and stuff. And I think I'm helping you this year actually organize it, so that should be fun.
Yes.
Looking forward to it in February.
Yeah.
Were there any sort of teaching or educational benefits or skills that you took away from your extra year of training that you sort of applied in your practice?
Yes. I think... I guess there are many things that I picked up during fellowship that I use daily in my practice, in my teaching. But I think just having spent so much time and that I invested into that one subspecialty gives me a really good fundamental view of the subspecialties, so that when I approach teaching the topic to a resident, I guess I gain more of an appreciation for the many steps that it takes to get to becoming a proficient regional anesthesiologist.
Yep.
A lot of times in residency, I feel like there's certainly a method to teaching and instruction, but sometimes too, depending on how days are scheduled as a resident, you might, as a first-year resident, get thrown into a abdominal aneurysm case, or on call you get these really crazy cases. So I guess I'm just saying there's not usually a sequential, like a step from a first step, then a second step, third step, kind of like as a baby you're learning how to take a step, then do a walking, then running. Sometimes we, just the nature of our job, we get thrown into like a swimming pool, and then you gotta learn. So all this is to say that I guess I feel like I have a better knowledge of how to adequately guide somebody through all the steps that it takes to get there.
Well, I can certainly attest to that you help us out with a lot of our POCUS programs. And I know whenever we have a regional day together in the OR, it's always a huge learning opportunity for me too. So
thank you. Appreciate it.
Yeah, I can certainly, just for our listeners, attest to how great Dr. Yang is at teaching us all those skills. So that's really great. And I guess you've already touched on a little bit how you were starting a new relationship with your girlfriend, now wife, and that might have been a bit of a challenge, but also an opportunity for you guys. Are there any, when somebody is considering a fellowship, some of the outside of work factors, whether it's financials, where to live, things like that, any advice that you'd have for somebody in that respect?
Yeah, for sure. I think that is something that, for me personally, I have lived in Saskatoon, so I didn't really have to worry about moving or relocating for a long time. My whole training was here. So when it got time to applying and getting this position, all of a sudden I had to switch gears and think about what's the city like? Where am I going to live? Do I bring my car? Do I just Uber it for the year? Do I walk? All these things to consider. So certainly a fellowship is it's I don't want to but sacrifice is maybe too harsh of a word, but there are things that you have to give up.
It's a commitment.
A commitment.
Right?
Yeah, that's a better word.
It's a commitment for a year.
Yeah. And then from a personal perspective, whether you have a significant other or children that you depend on you, those are certainly big considerations to make too, because it is a lot to ask of. It's not just you. Sometimes you're uprooting a lot of people to go travel, or do you split up and do a year apart? It might be doable if you're just neighboring provinces, and we're quite used to driving long distances in Western Canada.
As we are.
But yeah, if you move further than that, then definitely there's some consequences.
Yeah, things to consider, right?
Yeah,
and
exactly.
probably nice to plan early. Hey, when you are considering those things. So,
and also financially, you're mentioning you do get paid as a fellow. The payment is all over the place. It's kind of one of the downsides to a non-accredited fellowship pool route is that your stipend there's no standard rate. You don't get standard holiday, like a minimum set amount of holiday. Although, as far as I know, most programs will give you some days off. And then, in terms of benefits and all that, you don't really get any of that. So those are things to consider if that is part of the
that's really good insight. Probably not something that everybody thinks of quite as much. So I guess that would depend on the program then that you're applying to, and maybe something to clarify when you are applying. I guess.
And most will be pretty upfront with how much the salary will be.
Okay.
It's well, actually, for my fellowship program, I got paid a flat salary. From what I know of some other fellowship programs that I know some of my colleagues have completed, they also have the option of working moonlighting shifts beyond your service days to make extra income.
Okay,
so,
and that would probably be more at a staff sort of level of stipend if you're doing that moonlighting, but
that would
obviously
be exactly
within the realm of general anesthesia. Right. Okay, cool. Yeah. Different opportunities, different things to consider.
Yep,
yeah.
exactly.
Okay. Awesome. Is there anything else that we didn't touch on that you wanted to share about your experiences, or anything that you gained during your fellowship training or afterwards?
I think we covered most of the major things, but for me, I always look back at that year, and I'm really thankful that I did it, because it was really the opportunity of a lifetime for me to go live in a totally different part of Canada, see different things, and meet some wonderful people.
Yeah.
I think, as much as the clinical content that I learned, I think what was equally significant for me was just the different perspectives that I picked up during fellowship. Seeing things from a different angle, and seeing how other places work. There are some great things that I saw, but there were also a lot of things that made me really thankful for a center like Saskatoon where I trained. And so I was certainly at the end of my year, I was very, very happy to return home and return work here.
Yeah, cool. One of the many plugs for Saskatoon, if anybody hasn't noticed. We're quite biased on this podcast about it, but and Regina, of course, too. Yeah. Awesome. Well, thanks so much for joining us, Dr. Yang. This has been really great. Very insightful, both myself and our listeners, and I think lots of great information and experiences to pass along. So
thank you very much.
And then to our listeners, thanks again, and we'll have part 2 coming up very shortly. So thanks. And we are back for part 2 of our fellowship podcast episode. So we have 3 more amazing guests, all staff anesthesiologists who are part of our department and joining us at the end of another long workday. So thank you very much, you guys, for joining us. Again, we'll let you introduce yourselves, tell us a little bit about your anesthesia practice profile, and then as well, sort of where you underwent your fellowship training as well. So Dr. Urmson, can we start with you?
Sure. I'm Krissie Urmson. I am a pediatric anesthesiologist working here in Saskatoon. I did my fellowship in Calgary at University of Calgary at their Alberta Children's Hospital. And then I also worked for a year at Sick Kids Hospital in Toronto, just to work while my husband was doing his fellowship. And I work mostly, I'm part-time. I'm about 3 days a week, give or take. But I just do pediatric anesthesia now. I've given up the adult world and love my life because of that. So, yeah.
Very sweet. Okay, awesome.
Okay, I guess I'm next. I'm Monica San Vicente. I did my fellowship in obstetrical anesthesia. I went to Boston. I did at the Brigham and Women's Hospital through Harvard. My practice is mostly general anesthesia with 1 day a week of obstetrics. I work between 4 and 5 days a week. Half my call main OR, half my call obstetrics. And I'm happy with my practice profile right now.
Awesome.
Excellent. I'm Ashley Meister. I did a fellowship in regional anesthesia at the University of Ottawa, where I also did my residency. And my practice profile, probably like my colleagues here, has really evolved with time. And at present, it's just a mix of adult anesthesia. And I don't specifically do as much regional anesthesia, but I find that it's incorporated in all the other aspects in a nice way at this point in time.
Okay, very cool. And I guess I'll just throw this one up to the group now, but what were sort of the motivations that you may have had during residency in terms of looking at pursuing a fellowship, and when did you come to that decision?
I decided as a resident, I thought personally I needed a little more training. I was fairly anxious and didn't feel like I was really prepared to start practice after my 5 years of residency. So I was looking for something else. I had done an elective at Alberta Children's Hospital for peds anesthesia, and they were great to me there, and I enjoyed it. So that was great. I had looked at some other options as well, and once I had done those, I realized, you know what, I think Calgary would be a good fit. And it was a great year for me to go do that. I came back feeling more confident. And honestly, I think I came back, there's a bit of an air of mystery of what have I been and what have I learned? And that, I think, helped to give me just a little more maybe credibility, because I was a young female anesthesiologist and just starting out. And I think having that something extra, I think surgeons at the time maybe took me a little more seriously because I'd been elsewhere and done something other. And I think that helped.
I fell into obstetrical anesthesia, I would say. So I didn't know if I was going to do a fellowship, but I was finishing in the era of you should get a fellowship because we don't know if there are going to be jobs available. And I was around a 3rd-year resident, maybe 4th-year resident, and was trying to figure out, nope, definitely not peds. That was ruled out quickly. Didn't love cardiac. Those were long days. I knew I had already started my family when I was a 3rd-year resident. Thoracics I wasn't passionate about it. I was not drawn to regional. So then obstetrics. And I got kind of wooed and into the obstetrical field by the current head of the obstetrics department, and I was good at it. And so I went to a meeting that was very obstetrics oriented, and I met a lot of people that were from Harvard, which seemed very impressive at the time. They said, you should come interview. I interviewed and shockingly got a fellowship spot. And I kind of bumbled my way into it, I think. But I don't regret it. It was a great life experience. It was before my children were in school, so it worked well with the family. And my husband loved living in Boston. I would say he, of the whole family, loved the fellowship the most.
Yeah, he got the most perks.
There was a lot of sports he will talk about. I worked a lot. You know what? I came back, and there's... every obstetrics day or shift I have so much confidence. Mm-hmm. I know my stuff. I'm technically comfortable. So there's value in feeling really confident in part of your practice. Mm-hmm. So yeah, I no regrets.
Very cool.
Yes, for myself, I chose regional because at the time it was a skill that people didn't feel confident about and didn't really have and didn't incorporate in their practice unless they had a fellowship. Really, at the time, it was the uptake of ultrasound was rapid at the time. So that was a new equipment thing that was going to eventually really revolutionize the subspecialty. So it was really an opportunity to gain skills. And I wanted to be able to offer those to patients when I was in practice. So that was the biggest reason. But also at the time, there was a really important mentor in my life who did regional anesthesia. And so I thought, well, that's another opportunity to work with someone closely for a year. And it was just, I think and then the other third part was what you guys have echoed as well, just another year of the journey of lifelong learning, which was a good year. It's a nice transition point to have already have finished your residency and just gain a little more comfort, more skills, and unique things with a fellowship as well, because you also are expected to do a lot of teaching and work with a lot of junior learners too. So that's why I chose regional.
I think the other thing for me for pediatric anesthesia, it was, as Monica alluded to, it can be quite intimidating and scary. And one of the reasons I went into anesthesia in the first place was when you're a medical student and walk around the hospital, when bad things happened, the anesthesiologist magically appears and saves the day. And I thought that was really cool. And I wanted to not be afraid of anything in the hospital. And I thought an anesthesiologist kind of does that. And then that's kind of the scary thing then as a resident was peds. I'm like, I don't want to be scared of anything. So then I did my peds fellowship from there, forgetting, of course, that to go from not being good at it to being good at it can be a very steep, scary learning curve. And I forgot that would happen again with peds. But it was still, I'm still really glad now, because now when I'm working, I feel confident, and it was nice to work when people around you were nervous, like, oh, this one's scary. I'm like, actually, this isn't scary. This is going to be okay. So that's another part for me.
Mm-hmm.
Very cool. I mean, I've worked with all three of you in the OR, and you guys have never seemed fazed by anything, which is very cool. So, and I've worked with all of our staff lots, and it's just amazing to work with all of you. One thing I guess all three of you touched on was you sort of maybe clicked with somebody, or there was a mentor involved at some point during your residency that sort of helped guide you towards that fellowship, I guess. Maybe as somebody like a junior learner like myself, how do you go about kindling those relationships, meeting people to sort of help you sort of guide through residency to figure some of those things out? Do you have anything that comes to mind?
I just want to be with the cool people were. And they definitely seemed like some smart, cool people were in peds anesthesia. And it's like, I want to be like them. They're not afraid. They're so smart. So a little bit was me. I just wanted to be like them.
Yeah, that's true. I felt like I was wooed, I guess. Like, oh, you're so good at this. And the nurses are like, oh, we love it when you're on the unit. And who doesn't like being appreciated and praised? And when you're kind of a junior resident and you're getting this affirmation, like, oh man, I must be really good at this. And then it can't help but shift your perspective of, maybe I do like this more. Maybe I am good at this. So yeah, I think it was just the encounters I had. Yeah.
Okay, cool.
Yeah, I think that's true. I think a lot of now working with residents, I think there's a lot of opportunity to discuss people's interests, what brings them joy, what makes them tick. And sometimes you just click with people. But I don't know, I feel like as part of our role as a staff is to encourage people and find out what might work for people, how they think. Maybe they want to be with all the cool people, or maybe they like the technology of something, or maybe they want to be the expert in a certain field. So I think just open conversations are great to explore what might be a good fit.
Okay, very cool. And we don't have any fellows here at USask or any fellowship programs. So what does a year of fellowship sort of look like versus a normal day in residency? Is it fairly similar, just focused in that specific area of anesthesia that you're practicing, or what does the year of training sort of look like?
I think for me, it was like I had done an elective at Alberta Children's, so it was very similar to that, except instead of being there for, I think it was there for a month, I was there for 12 months. Mm-hmm. So it was very similar to what I'd already done. I knew a bunch of the staff. I think having an opportunity to do an elective first was very helpful to kind of know what you're getting into. I think to sign up without having done an elective would be a little bit intimidating, and you might not know exactly what you're getting into. So I was really lucky that I had done that. It's kind of like residency. You can make it what you want. If you want to like do extra weekends, do some research, there's usually those opportunities to do that extra stuff. But I think for like anything, it's kind of what you make it.
Yeah. Okay.
I totally went in blindly. Was not at all prepared. But the beauty of coming from a Canadian school and system, and we had just finished our exams, and I was at the height of my knowledge, was exceedingly valuable going into the US, where a lot of their senior residents haven't written exams. So that brought confidence quickly. But let me tell you, I was a little nervous those first few days. The place that you go to, like at the Brigham, it's the drawing center for all of New England high-risk obstetrics. So the sickest moms were sent there. They had two very distinct departments. One was private obstetrics and one was public obstetrics. And so I actually preferentially worked with the public system, where you would see someone coming in with an acute sickle cell crisis who's term and laboring. And I had never seen anything like that here in Saskatoon, Saskatchewan. I do think our patients are getting sicker now here and are actually matching a little bit more of what I saw when I was at the Brigham. But at the time, those patients were shockingly sick, something I'd never encountered. And so I thought if I can deal with these people here, I can deal with anybody back home. So it was just, a lot of obstetrics, but a lot of high acuity obstetrics. That was really valuable.
My fellowship year was great. It was pretty relaxed, actually, and not very intense. And I got different things from it than maybe I even expected or wanted at the start of it. But each fellowship is coordinated differently. But mine was 2 days in the field that you were doing your fellowship in. So 2 days of regional anesthesia. That was lists that you were likely to do some type of regional anesthetic. And then 2 days of independent practice and some research and other academic things. But honestly, the independent practice was really like a transition to practice, because you end up just getting, slates that you don't always see as a resident. You just get things that come in and things that change really quickly. Like, for example, those rooms that aren't scheduled. So I found that I got really high acuity cases and just more real life examples than what I'd had leading up to that in the final years of residency, where you think that every case is, what they do in the ivory tower, and you've had time to think about it and plan for it. But a lot of what happens when you're out in practice is routine things, and then something else is added onto it, whether it's from a patient point of view or a surgical point of view, that really just made you more comfortable in this new transition to practice of being a staff.
Okay. Very cool. And then besides, the obvious extra skills that you gain within that discipline, Dr. Meister, you've touched on this a little bit already, but were there any other skills, any other benefits that you found that extra year gave you, outside of just like the technical practice of anesthesia?
I know for me, it was a networking opportunity as well. So, excuse me, when you start doing this, like going to pediatric anesthesia, I go to Canadian Pediatric Anesthesia Society meetings, and it's a very tight-knit community to some degree, where you see the same people all the time and you create friendships across the country because of that. So I think it's sort of a stepping stone into another cool kid club, I look at it, but of just hanging out with these other really neat people from across the country. So I've got friends in places all over Canada now because of the fellowship, and it just sort of opened up this opportunity. So I think for me, that was one of the unexpected perks I didn't expect, was all the neat people that this fellowship would kind of flow into.
Yeah. Okay, cool.
I felt like my time at the Brigham, it's a very research-heavy oriented place, which we didn't have a lot of it at that time at the UofS. I think we've now really bolstered our research, expertise here. So I was exposed to more days off and academic time and research opportunities there, and it was good. I evaluated it. It's not become a huge part of my practice profile, but I feel like that was an informed decision.
Yeah. Cool.
I think another opportunity that fellowship offered was being exposed to how things are done in another place.
Mm-hmm.
So specifically, I had been doing my residency in Ottawa, and there was an opportunity to continue to learn this additional skill. But I wasn't planning on staying there. I wanted to be closer to family, and that was in Saskatchewan. And it was really nice to work in another place before starting my career and seeing how things were done. And I think that gives you a perspective that is very valuable.
Mm-hmm.
You can be flexible in your decision making. You just have a little bit more experience. And it was nice starting as a new staff that I already had this experience and felt a little more experienced than I would have without a fellowship.
Mm-hmm.
And bringing new ideas.
And
Look,
the
I love
value to
it
a
when
new place,
people
yes.
go and do fellowships and they bring back new equipment or new, you're like, hey, wow, like, where did you new tape? Where do you learn that? That's genius. How did we not think of that? And it's usually people that did fellowships that bring these great new ideas back.
Yeah, to train in different places, and then there's such value to train in somewhere else other than where you're planning on working.
Mm-hmm. It was nice too to have somebody else say, hey, you guys are well-trained residents in Saskatoon, because you're never really sure, like, are we just a little small town and we don't really train good residents? But when you go away and all of the residents, we go for peds fellowships at least, people say, like, we have great residents and we do a good job training them. And that was, I think, really nice for me to realize that our program has trained me well and that I'm in good shape. Whereas sometimes when you're in the middle of it, you're not really sure. But having gone away to have someone confirm that was really nice. It was validating.
Absolutely. Though I heard that all the time when I was in the States for that year. Like, we're very impressed with Canadian trained residents. They're always, very skilled, very knowledgeable. Like, thank God I spent all that time studying that fifth year.
Yeah.
Exactly. Like, it was worth it then. Yeah.
Cool. So, those are a lot of amazing benefits to doing a fellowship. And so for somebody who might be thinking about doing a fellowship, how did you go about organizing it? I know some fellowships are through the Royal College. Others you sort of maybe apply for and interview for. So I'm sure all three of you have different sort of experiences in that. But do you mind just touching on that a little bit?
Well, mine was lucky in that the reason I went to Calgary primarily for my elective was I have family and friends in Calgary. So I wanted to just kind of go and, do an elective somewhere where I had somewhere to stay and a little time spent with good friends kind of thing. Mm-hmm. So that gave me the opportunity to meet those people. Now I would say for pediatric anesthesia, at least, the residents we know here in Saskatoon we can connect them to places all over Canada. If they want to go to Vancouver or Edmonton or Calgary or somewhere in Ontario or down east, we have connections there and we can get people set up there. So I think, and that's the nice thing about pediatric anesthesia, it's such a small community that most people will know most people or know someone from places. And it's a very supportive community. Like, we want people to train. We want people to have those connections. So we can certainly help facilitate some of that. So as far as like setting it up, and then it's nice sometimes to go do that elective, check it out, see if this is a good fit. And then they can also help with, these are our next steps. This is what we need from you. And most places are great about communicating back. This is our process. Let us know if you need help with anything.
Mm-hmm. Okay.
Mm-hmm. I got connected with my application process through that meeting that I went to while I was still a resident. And then they forwarded me the information and what I would have to do to get a visa and work in the States and what hoops I would have to jump through. So I feel like a lot of that was facilitated because I had made a face-to-face connection with people. They know now who Monica San Vicente is when that email pops up, and that then they know who they're sending this information to. I don't know any. I just applied to the one place and they took me.
Awesome. Are there specific requirements to work in the States or any barriers that you faced?
So every state is a little bit different, and some of them will require you to work the USMLEs. Right. And some of them will require different visas and licensing. And so the beauty of Massachusetts is that they take a lot of international fellows, a lot of people from Ireland and England and Australia and Canada. So they allow people to come on a student visa without USMLEs. Now, if you wanted to stay, you'd have to jump through a few more hoops and write those exams, but you could be there for the 1 year. And I think they're really great about promoting education and disseminating their knowledge and skills and ideas to various places. So you would have to find out what each state requires.
Okay.
I think what Krissie said, I echo that in terms of doing electives where you can. And that might even just be starting with, exploring with the staff what kind of interests you might have. And is there anyone that you know that's done that fellowship? And then reaching out, see if you can do an elective, and then just, casting the net wide too. And you can see what places are available. But you probably want to touch base with someone who knows a little bit about the program or what it actually is like. The elective would be the best, but.
Right. Yeah. So electives, chatting with mentors, chatting with other staff that have gone through the process, probably very helpful for residents that are thinking about it too.
Yep.
Okay.
Yeah.
Awesome. And then I guess for learners that are thinking about performing a fellowship or doing a fellowship, there's some sites where you don't need a fellowship to work right now. There's others where it might be required. So for those considering, what is your selling point, I guess, on doing an extra year of training? What is the benefit if somebody is considering it?
Well, it's a cost to do it. That's the downside of doing it. Well, a couple, and that you'd have to go somewhere else. So you lose, not so much a cost, you lose money or income for the year to be a student again. But I think a lot of programs where you do it like afterwards, you probably end up in a potentially more lucrative field. I would hope should be part of it. But part of it is I like going to work every day. Like there would be days before we opened our children's hospital where I did a mixed practice, and there were days I would dread going into work with an adult list. And now every day I'm excited. I get to do what I really like doing every single day. So that'd be I think for me, the big selling feature is it's not really work if you're having fun doing it. So
awesome.
Yeah. I think that the beauty of feeling really confident in an area of your practice is, I never dread an obstetric shift. I'm never uneasy about being on the unit or being there on weekends or night shifts. I know I can handle what's going to come my way. And sometimes when I'm in the main OR doing call and I know that something quite critical, like a gunshot wound's coming in, you think, oh my God, I feel more impending doom sense there than I would ever on obstetrics. So there's value to that. Downsides, definitely loss of income. I don't think you need to practice obstetrical anesthesia with a fellowship. I think you can be very competent if you're as a generalist. But for me, it was a great opportunity. My husband was overjoyed to go. So you know what? It worked out. No regrets. Yeah.
Cool.
I think that's true. It's I came from training in Ontario where fellowships were expected, actually. And so it never felt like an obligation. It felt like an opportunity to choose something that you wanted to do more in depth or become an expert in or have because you needed it to work in a certain type of practice. It was just a real opportunity to tailor your training. Mm-hmm. So I never saw it as, I didn't really see a lot of disadvantages. I guess I just presumed that I was going to do a fellowship, and then I sort of thought, well, what would be interesting? And then I agree, it didn't really seem like work because you're given that other opportunity to just practice and get your feet wet and still have an opportunity to learn this additional skills, which in hindsight now, when I think about that as a staff and look back at doing a fellowship, I would love the same type of opportunities, maybe on a smaller scale than a year-long fellowship commitment, but to be taught by experts and to be exposed in the latest knowledge, because once you're done in staff, you're on your own journey of lifelong learning, and it's your own prerogative to keep up with things and to learn a new skill that you don't have the resources of an expert right there beside you who will walk you through it until you're comfortable and gain those skills. It's really, it's really your own prerogative. But so I thought that was it was a nice opportunity with the fellowship.
Cool.
I think when you're a generalist too, I think there's an expectation that you would do like a generalist practice. And I think that is rewarding in its own way for people who want to do that. I love the idea that I can tailor my practice a bit more, or I can move to a different center where I have more opportunities. If I want to live in a major center in Canada, I have the opportunity to do pediatric anesthesia, or a more generalist practice, but I have that opportunity to choose. Whereas I think if you don't do a fellowship, then you're a little bit limited with working at a hospital, and these are the lists that you're going to get. And it might not be the ones you want to do. You might want to have more variety, but without that fellowship, you might not have exposure to those. When I was a resident, we had someone move to Vancouver, and it was a pretty, I don't want to say boring, but very limited practice. He couldn't do the thoracics and neuro and peds that he used to do because that just wasn't an opportunity for a generalist. So I think if you want to move or go somewhere else, like Saskatoon's a great place to work, so you can do lots of different things here. But I think if you want to live in some other centers, having a fellowship does give you different opportunities and different options. When my husband did his ortho fellowship in Toronto, I had the opportunity to talk to the staff at Sick Kids to see if I could work there. And if they didn't, then I still had opportunities as a generalist. I had multiple things. So actually, and it worked out. I did work at Sick Kids there, but it was nice to have the opportunity to choose and to kind of fit what I wanted to do.
Mm-hmm.
Cool. It sounds like, opportunity is sort of the resounding word that I keep hearing, which is awesome. Yeah. Instead of an obligation viewed as like just another chance to experience something different, which is very cool. I guess, are there any factors outside of work life that you considered when you were starting your fellowship, things to consider for individuals thinking about doing a fellowship? Obviously, family, money, a little bit we've already touched on. Anything else that you can think of?
I was single, so it was easy for me. And honestly, I wasn't sure if I was coming back to Saskatoon after my residency. I had lots of opportunities, and so partly the fellowship was just to kind of see what's out there and what's different places where people are working. And then as it turns out, I did come back. But so it was simple in that way, in that I didn't have a family to move. I didn't have a ton of debt because it was just me. So for me, it was fairly simple. But I think if you do have family or partner obligations, I think it would be trickier.
Mm-hmm.
So
fair enough.
I really loved living in another part of the world and seeing another healthcare system. And you read about it, but it's different when you live it. And we loved it. We traveled all over the States because it was a lot easier. It's a heck of a lot cheaper to fly once you're in the States anywhere. So I think that there's, you make the most of it when you're there. And we have other people in our department that have gone to Australia or other really exciting places. And how cool is that to go live somewhere like Australia for a year?
Yeah.
So I don't know, like it's a life adventure for a year.
Mm-hmm.
Yeah.
Yeah, I think I naively hadn't thought as much about what doing a fellowship in a certain area would mean. Like I was always interested in cardiac. I thought that'd be fun, but at the time when I was a resident, I really enjoyed it. But now would I want to be doing cardiac anesthesia all the time? Like I didn't think about it as a lifestyle, or what that would mean for your work. I was just sort of thinking about what academically was interesting and intriguing at the time. So fortunately, regional was not a fellowship that was overly onerous, because certainly some can be. And it's something that I've, been happy that I can incorporate into my future practice. So I think, I probably didn't think about it as much as what I maybe could have, but maybe things all work out for a reason.
Mm-hmm.
Yeah.
And I'll echo what Monica said. Like when I lived in Calgary, we went skiing a lot and did a lot of those fun things, which I didn't have access to living in Saskatoon before that. And then when my husband did his fellowship in Toronto, you could just like hop on a flight and we went to Pittsburgh to see family, and it was so easy to travel. And I mean, I love working in Saskatoon. I really do. But it was nice to have the big city life for a year or next to the mountains for a year and do some of those fun things, and just try out a city for a year.
Mm-hmm.
And I'll say I'm not a big city girl. I don't think I could handle living in Toronto all the time, but living there for a year was pretty amazing. That was great.
But the other thing that it afforded was honestly employment, because hiring for anesthesia was and still is very cyclical. It will depend on things outside of your control. Even within the department, it depends on politics, it depends on the landscape, it depends on baby boomers, it depends on an epidemic. There's so many things that we can't control. But so there was a recession right before I was finishing my residency, and previously becoming an anesthesiologist and getting a job was very easy. And then all of a sudden, the next year, no residents had jobs lined up, and it was very difficult to find any work. So I'd already planned on doing a fellowship, and that's why I got a job in Saskatchewan, because I knew I wanted to be closer to family in Western Canada. So looked around, but I wouldn't have been hired without a fellowship. It was just something that they wanted at the time. And that was very fortuitous.
It's hard to imagine, because now it seems like there's jobs everywhere, but it definitely is very cyclical. When I was a resident,
it is. Yes.
People were like, why are you doing a fellowship? Like there's jobs everywhere. You'll always be able to get a job. And I'm glad I did. I really enjoyed it. It was great. I love my practice now. But at the time, it definitely felt like this seems kind of silly. But I'm glad I did. And then, not too long after, there's that bust. And now we're back to having like a boom ops of jobs available again. But you can't always rely on that.
No, you can't. And I don't think there's ever any lost periods of education. All learning is good learning. And, I don't use all regional anesthesia in the way that I thought I would, with the specific techniques that I had learned, but I've evolved and I'm more flexible and uptake new skills in this other area of regional anesthesia that developed, that wasn't even around when I was contemplating a fellowship. So I think all learning is good learning, and you're still going to get some skills out of extra training.
Awesome. This has been an amazing discussion, and thank you for sharing your insight, your experiences. Was there anything else that anyone wanted to mention before we sign off? No.
I don't think so.
No, I think that's good.
Yeah.
Well, thank you for joining us. Yeah, I think
Thank you.
this is going to be an amazing, very educational for all of our listeners, and it has been for me. And so thanks so much for joining us, after a long day of work. And thanks. And so we'll sign off for now. And thanks again to Dr. Yang, who spoke with us earlier as well. And thanks to our listeners who tuned in, and we will chat with you again next time.
You've been listening to Airway Breathing Conversation, a podcast hosted and presented by the anesthesiology residents at the University of Saskatchewan. Please note that while this podcast is run by healthcare professionals, it is intended for educational and entertainment purposes only. We are very thankful to our guests for taking the time to share their wisdom with us this episode, and a very special thanks to you, our listeners, for tuning in. Don't forget to follow us and our associated USask Anesthesia accounts on social media. You can find all our social media links on our Linktree page at linktr.ee/abc_podcast. You can also find the department's social media links on their Linktree page at linktr.ee/usask_anesthesia. We'll see you next episode, but until then, stay calm, take a breath, and always remember your ABCs.